So this has been a great discussion. We've gone over a lot of information. We talked about the incorporation of new service lines into big group practice. I think to close, I'd like to get some final thoughts from all of you in terms of what you want the viewers to really hear from you as an individual and again as thought leaders within your own particular areas. Sandy?
Well, I think the advancement of quality care is going to be very important. We're going to look at evidence-based medicine to start to look for, to be able to accumulate data, because without data you can't do outcomes and you can't do cost analysis. And the only way you're going to have a better relationship with your insurer is by presenting these outcomes and cost data. I also feel that having a strong social position in the community is very important. I think what you do in the community is really a differentiator with other groups there that participating in activities in your community, whether they're prostate cancer screenings, whether you believe in that or not. I think all those things that bring better recognition of your practice is what's driving us in Baltimore to just make it all better for everybody there.
Richard?
Well, I think Sandy kind of stated it very eloquently, but I do think that the ability of being these large integrated practices allows us to embrace a lot of this technology, embrace a lot of these new concepts that we couldn't do. I mean, there's no way that a 3, 4, 5-man group could purchase a multi-parametric MRI system. It's just prohibitively expensive. It allows us to do that. I mean, we couldn't do Xofigo, we couldn't do Provenge infusions, we couldn't have an IMRT center. So at the end of the day, as we've talked about for the last hour plus, it's really all about improvement of patient care. And that's really, I think, why we all brought these integrated concepts together. I mean, I think with data management, we're going to be able to enhance our ability to look at our outcomes and to add the patient improvement also. So I think again, just to emphasize how important these integrated groups are, that they allow us to do things to get out to our patients and improve their care that there's no way we could have done as individuals.
Dr. Kirsch?
Well, Raul, I want to follow up on this word that we've used a lot, and the word is integration. Integration can mean lots of different things in lots of different groups. We have integrated care. We've talked about it a lot with all these different services, and it's very important. My message to the listener, the viewer, is that you must climb higher on the integration scale in your group if you wish to survive the future challenges of healthcare. You must break down the traditional silos that exist between physicians. You must learn to subspecialize. You may have to learn to consolidate locations. You have to become a more truly integrated group in order to survive in the new healthcare paradigm that's emerging. And I believe this is the biggest challenge that our industry faces, our large urology group industry faces, which is helping groups progress along what I call an integration scale. And I think we're going to be looking at that more as an organization.
Well said. Neil?
Well, let me just, I think on behalf of all of us, thanks for putting together a great panel, Raul. It's awesome, great dialogue. I agree with everything. Simply put, inertia is the enemy. Inertia is the enemy. Leadership is essential, innovation is mandatory, and we have to embrace the change that we've talked about today. And that's the only way we'll remain a viable opportunity for the independent practice of urology and medicine.
I mean, I think you've said it before. Change is hard, but with change comes opportunity, and also, if you think you've changed and it's easy, guess what? You probably haven't changed anything. So, anyway, on behalf of our panel, we'd like to thank you all for joining us, and we hope you found this peer exchange discussion to be useful and informative.